But before we dive into the product and its uses, let's discuss the reasons why we believe there's a need for this new technology in healthcare organizations. Let's start with the focus on quality. Healthcare organizations, the need for quality improvement is driven by the shift from fee-for-service to fee-for-value payments. With HCAHPS scores affecting reimbursement, hospitals are challenged to improve the patient experience and clinical processes in general. This means there's a greater need to standardize treatment and monitor processes for compliance and quality control. Likewise, clinicians are more concerned with operational efficiency now. They want as much time focused on the patient as possible. They want to eliminate superfluous tasks where they can. Patient education is now even more critical. Providing more information about procedures is a top priority, as well as helping the patient navigate steps in their care journey. For example, offering customized task lists and directions is an important step towards creating a better patient experience. So one way clinical leaders are trying to promote better quality care is to require nurses, doctors, and surgeons to use evidence-based guidelines, checklists, and other tools to ensure they meet the healthcare organization standards. But there are some challenges. For some processes, niche electronic options might be available, but they're often expensive and siloed. Because they're not integrated into their clinical systems, adoption is low, and the quality improvement never happens. When manual processes are mandated, for example, having staff fill out a paper surgical checklist, they fail to deliver the data that stakeholders need. It's difficult to monitor the processes, identify deficiencies in care treatment, and gain insights to truly improve care. But given that it's better than nothing, most organizations resort to managing these important tasks on paper and continue to struggle with a lack of data and efficiency around them. Most of you will immediately think of cheat sheets or checklists that your nurses carry around in their pockets during rounds. But this is even true of required forms in the organization. Bedside consents is a form that we hear about a lot. They're frequently on paper in many hospitals, and clinicians recognize the challenges associated with manual consent processes. And as you dig into it, there are many forms that are still paper-based. We actually surveyed materials managers at the recent ARM conference and found that 92% reported they still manage a portion of medical forms on paper. There are an endless number of documents you could automate with FormFast Capture, but we're going to be focusing on a few that we hear about a lot. We're going to refer to these as Outlier Documents. Those include point-of-care checklists, informed consent forms, evidence-based guidelines, rounding sheets, ancillary care documents like physical therapy, anesthesiology, sleep lab, and many other forms of specialty care documents. Now, obviously, there are many factors that play into the quality of care, but this is a central issue that we feel like is pretty easy to address, namely automating these outlier documents. While the solution is easy, the impact is significant. You can imagine a cascading effect originating from an inability to properly document activities. So think about the negative impact. Without a way to collect data regarding important events like surgeries, rounding, and any number of clinical processes, it's impossible for leaders to identify issues with processes, so quality risk persists. So in short, we find that many poor processes and negative outcomes stem from limited data and insufficient documentation. Therefore, FormFast Capture empowers you to eliminate these gaps in documentation so you can collect the data you need, analyze and improve processes, and ultimately deliver a higher quality of care. Of course, these document gaps impact more than quality. Most agree that there are multiple problems with paper-based processes. For starters, they're inherently error-prone and slow. For instance, manually scanning documents like informed consents into an archive introduces the risk of indexing errors, not to mention the risk of delays in care. Likewise, clinicians support automating paper processes because they feel like paperwork pulls their focus away from the patient, and they want as much attention on the patient as they can. There's the financial impact as well. Of course, there's the cost of paper and toner, not to mention the warehousing and other overhead expenses. There's also hidden costs that affect compliance and quality. Obsolescence is a huge concern. If clinicians end up using outdated forms or guidelines, it can result in patient safety and liability issues. That also affects quality. Clinical standardization is limited with paper-based processes too, because it's difficult to ensure that staff are adhering to the latest version of protocols. And then there's the effort associated with trying to get actionable information out of paper documents versus electronic systems. It's difficult, if not impossible, for healthcare leaders to make good decisions without access to real-time data about clinical workflows. So with paper-based processes, someone has to manually review those documents, rekey information into another system, and try to determine what the data means. In modern hospitals, we find expect a better way. So you may be asking yourself, so what? So we have a few processes that we manage on paper. Why is that a big deal? And that's an understandable question to ask, especially if you're thinking about a handful of processes or a couple of forms. However, in aggregate, all these process bottlenecks compound to make an enterprise-wide problem that impacts multiple areas. Every form that's manually scanned, every process that goes unautomated, every process where there's a lack of data contributes to a drain of efficiency, costs, and quality across the organization. So solving this problem is something that stakeholders throughout the enterprise can get behind. FormFast Capture provides wins for multiple stakeholders. Clinical leaders and clinicians get the data they need for quality improvement and more time with the patient. IT and HIM get the tools they require to better manage documents. The COO sees the value of improvements in operational efficiency. And the CFO appreciates the hard cost savings plus other benefits to revenue it provides. Another important benefit of FormFast Capture is how it complements your EHR and your larger documentation strategy. So a common remark that we hear when we talk about these challenges is that the hospital leaders assume that IT will add those documents to the EHR. And while it's true that many documents that we'll discuss could theoretically be custom built as part of the EHR, there are several reasons why your organization may choose not to. First, some documents weren't necessarily designed to be a part of the EHR. Documents like certain guidelines, checklists, and rounding are important to care, but aren't part of the patient's electronic health record. However, clinical leaders will agree that they still need to be automated to improve quality. And that category of documents illustrates the importance of having a product like FormFast Capture. In other cases, it simply doesn't make sense for the hospital to develop these documents in the EHR. The first factor is time. Many hospitals have found it takes too much time to custom build forms within the clinical system to justify the effort. Depending on the form, it can take weeks or even months to create a single interface that can collect data. Given there are nearly endless documents they'd like to automate, the idea of custom development is daunting to IT leaders. Another related factor is cost. These form interfaces must be created by expensive EHR developers. With budget stretched thin as it is, that's a deal breaker for most organizations. And then the third reason is manpower. Even if the organization are EHR developers, they're usually allocated to optimize modules that are already implemented or to address other high priority tasks. Therefore, the decision is often made not to automate certain specialty care forms and personalized consents, checklists, and guidelines. That's why FormFast Capture is the perfect complement to the EHR. We're allowing you to automate the Outlier documents faster, cheaper, and more effectively than with other systems. FormFast Capture, you can create the electronic documents in minutes, not months. We give you tools to automate your remaining forms at a fraction of the cost of building EHR interfaces, and we're the specialists in electronic healthcare documents. Our software is designed to solve these problems, so choose FormFast to automate these documents and save your EHR developers for other mission-critical tasks.